An autopsy is a post-mortem or after-death examination of the body, which includes the dissection of a corpse. By law, deaths that are violent, that occur within 24 hours of entering a hospital or as a result of a surgery, deaths that are natural when a doctor is not present or the patient is not under the care of a medical facility, deaths that occur in police custody or in a correctional facility, or deaths that result from a communicable disease that may pose a threat to the public health are required to be investigated. Let's take a closer look at the process that we go through in a death investigation. One of the most basic preliminary assessments in a death investigation is the manner of death, or the way that a person dies. The main ways that a person or manners that a person can die are natural, which is the most common manner of death, which is where the body function fails as a result of age or illness or disease. Accidental death, which is an unintentional death. Suicide, which is where the victim intentionally takes his or her own life, and the cause of death is usually a gunshot or hanging or poisoning. A homicide, which is when one individual takes the life of another intentionally or through a negligent or reckless act. And undetermined, which is when the pathologist is not able to determine the manner of death, even after all internal and external examinations are completed and the toxicological tests are evaluated. So first, we must determine the manner of death in a death investigation. Two systems of death investigation exist in the United States: the coroner system and the medical examiner system. A coroner is an elected official who may or may not be a medical doctor depending on the jurisdiction in which they work. The medical examiner is a medical doctor, and so they can perform an autopsy, as some are also forensic pathologists. In particular, a forensic pathologist is a medical doctor who is trained to identify why and how someone died and to present those findings in court. To become a forensic pathologist requires additional training beyond a 4-year bachelor's degree, your 4 years of medical school, and your residency program. There are 3 steps to a death investigation. The first step is the preliminary investigation, which occurs at the scene of the death. This is where we photograph the scene, sketch the body, and take notes of the position of the body, the face for identifying marks, the underside of the body for lividity, blood, and trace evidence. We look for any signs of trauma, we note the degree of decomposition, and we look for scene markers. Scene markers are non-biological evidence that provide clues about the time of death. At this point, paper bags will be placed over the body's hands and feet to protect any trace evidence that may be identified. During the preliminary investigation, the PMI, or post-mortem interval, will be examined. PMI is the time between death and the discovery of the body. Some clues that can help us determine the post-mortem interval are livor mortis and rigor mortis. Livor mortis is the body's change in color as the blood pools due to gravity. It first appears between 30 minutes to 2 hours after death, and by 8 to 12 hours after death, it is fixed. Rigor mortis is the stiffening of a body due to a lack of chemicals in the muscle cells. This begins within 2 to 4 hours after death and subsides within 36 hours. The degree of livor mortis and rigor mortis can help us determine how long a body has been present at a crime scene. The second step of a death investigation is the medical examination. At this time, the medical examiner will determine the cause of death, which is the immediate reason for a person's death. The medical examiner will also determine the mechanism of death. Mechanism of death is the body's physiological response that caused the cessation of life. The autopsy will be performed. During the autopsy, the medical examiner will remove all internal organs and record their mass. The medical examiner will also analyze the contents of the victim's stomach. Biological evidence will be collected. Blood will be collected for DNA. If the victim is unidentified, the medical examiner will collect blood from an artery and then place it on a blood card, and the card will be sent to the DNA lab for identification. If the medical examiner suspects that the victim was sexually assaulted, He or she places cotton swabs inside the vagina and rectum, removes the swabs, and makes slides of evidence. The slides are air-dried, and then packaged and labeled and sent to the lab for analysis. The examiner collects hair from the victim's body and places it in an envelope. The origin of the hair is unknown. Some may belong to the perpetrator, and some may belong to the victim. The examiner will document where the hair was collected, and he and she will also collect control hairs from multiple areas of the body. The control hairs will be pulled from the root so we can get a follicular tag, which is a piece of skin, so that DNA analysis can be performed. The medical examiner will place each tissue sample in separate sterile containers. Tissue samples are stored in a cool area such as a refrigerator to await further examination. If the examiner finds loose pieces of fingernail on the body, he or she collects them and places them in an envelope. The examiner then cuts the victim's fingernails and places each cut fingernail into its own clean, sterile envelope. The envelopes are labeled with the location of the fingernail. A forensic odontologist is a doctor trained to examine dental records and bite mark patterns during a criminal investigation. If one is available, a forensic odontologist will examine any bite marks prior to the autopsy before the body is cleaned. Non-biological evidence is also collected. Non-biological evidence can include bullets that are recovered from the body. If this is the case, the medical examiner is careful to keep the bullet intact. The bullet is placed in a labeled envelope, and the investigator identifies the area of the body from which the bullet was taken. Other non-biological evidence includes any surgical equipment, such as artificial limbs or rods inserted after serious fractures. This equipment often includes a serial number that can be traced to the hospital or even the surgeon who performed the surgery. This information can then be used to identify the victim. Another factor that is considered during the time of the medical examination is algor mortis. Algor mortis is the post-mortem cooling of a body. Frequently, the temperature of the victim is taken either rectally or through the liver, which is more accurate. And then on average, body temperature drops by 1.5 degrees Fahrenheit per hour until it reaches ambient temperature. Ambient temperature is simply the temperature of the air in the atmosphere around the body at the time of death. Listed here are the calculations for determining how long the body has been exposed. If the body is less than 12 hours old, you use this equation. And if the body is more than 12 hours old, you use this equation to help you determine the time of death. It's important to note that time of death is truly just an estimation. It is not an exact calculation. Although the body does cool at a fairly regular interval, you cannot determine the time of death down to the minute. The third and final step of a death investigation is the laboratory analysis. This is where samples taken from the autopsy are sent to be analyzed. Areas where samples can be analyzed include toxicology, histology, neuropathology, and serology. Toxicology is a science related to the detection of drugs, alcohol, and poisons. Alcohol is the most widely abused drug in the United States. Depending on what substance is identified, different tests can be done to determine exactly how much is present in the system. Histology is the study of tissues and diseases. Neuropathology is the study of disease and trauma associated with the nervous system. What would fall under this category is a fall or blunt force trauma, as well as brain diseases such as Alzheimer's disease and brain cancer. Serology is the study of blood, semen, and other bodily fluids. In this case, instances of blood-borne pathogens, the identity of the victim or the identity of the perpetrator would be examined by a serologist. At the conclusion of the death investigation, an autopsy report is generated. Although autopsy reports vary by jurisdiction, all autopsy reports will include a heading, the external examination, evidence of injury, internal examination, and it will end with the medical examiner's findings and opinions, which can be admissible in court. If you need to, please review this video again and take additional notes. When you are finished, please open the Autopsy Analysis Questions assignment in Schoology and answer all of the questions using complete sentences. Submit your work to Mrs. Benke for credit.